It's 6:49. The holidays are a time to spend with family, catching up, reconnecting. It's also a good opportunity to gather life-saving information about your family history. Chris Brown spoke with Dr. Vivek Deshmukh, a neurosurgeon with Providence Brain and Spine Institute, about this.
Well, aneurysms are one medical condition that most people don't realize can be hereditary. First of all, let's start with the basics. What is an aneurysm?
An aneurysm is a blood vessel abnormality, a weak spot on a blood vessel wall inside the brain. And the problem, naturally, is that being a weak spot, it can rupture, and that can be a catastrophic event.
What should you do if you have a family history of aneurysms?
If you have a family history of brain aneurysms, then it's important to consider being screened to determine if you have an aneurysm yourself. But it's important also to determine if you have two family members with a brain aneurysm, because those patients in particular are at a high risk for developing an aneurysm or having an aneurysm rupture.
Is there a particular age when we should start the screening process if you've got that history?
For patients with two family members with intracranial aneurysms, we typically recommend that at the age of 25, you undergo either an MRA, which is a very specific type of MRI. It stands for magnetic resonance angiogram, or a CAT scan angiogram. The drawback of the CAT scan angiogram is there's some radiation involved. So I would typically recommend an MR angiogram at the age of 25 for patients with two family members with intracranial aneurysms. Now, if you have one family member who's had a ruptured brain aneurysm, you may want to consider getting screened as well.
Okay, so do you just need to be screened once, or is this something that you'll want to do a number of times?
If you have two family members with brain aneurysms, then I would get screened at the age of 25, and then again 5 to 10 years later, because there is a chance that the first screening test may be negative, and then you develop something in the interim. And there are two lifestyle modifiable risk factors for developing aneurysms, particularly if you have a family history, and that is high blood pressure and cigarette smoking. So particularly if you have a family history of brain aneurysms, but really regardless, it's very important to control your blood pressure and stop cigarette smoking, because those two things can make aneurysms form, grow, and rupture.
Doctor, about 30 seconds left. Let's combine these last two questions. What are the physical signs of an aneurysm, and if you or a loved one is showing some of those, what should you do?
So typically most of us are walking around without any symptoms from a brain aneurysm unless it ruptures. And at that point, when an aneurysm ruptures, it's the worst headache of your life. It's a sudden onset explosive headache accompanied by nausea, vomiting, and lethargy. And in that scenario, I would go straight to the nearest emergency room.
Dr. Deshmukh, thank you so much. An important topic, and we appreciate you taking the time to fill us in on it.
It's my pleasure.